Hello, my name is Deborah Goldschmidt, and today I'll be talking about accessing values. This presentation is part of the series of presentations on mental health for healthcare providers in the COVID-19 pandemic. The learning objective of this presentation is to think about how to get back in touch with your values that originally brought you into this profession, particularly during this crisis. To start off this presentation, I wanted to provide some food for thought. What do you want to stand for in the face of this crisis? What do you want to be remembered for when this is all over? And of course, we hope that that's sooner rather than later. What sort of person do you want to be as you go through this? And also, how do you want to treat yourself and others? Now, some of these questions may feel more obvious to you than others, or not at all, but just take a minute and think about, how do you want to be remembered with everything going on? And I imagine there's lots of different emotions. Just take a beat and think about that. To introduce the concept of values-based living, I wanted to talk about this metaphor that we have in acceptance and commitment therapy. When we're caught in a struggle with our problems, like a tug of war, for example, we often put life on hold, believing that our pain needs to lessen or be alleviated before we can begin to really live again. So we're in a tug of war with our problems. But what if you just dropped the rope? Your problem wouldn't go away, but your hands would then be free to go about your business and do other things. So what I'm asking you is, what if you could have your life be about what you want it to be about right now, starting in this moment? What if you are open to the possibility of this, even if you don't quite believe it's possible yet? This idea, if we go back to the metaphor, that your problem is still there, but you're no longer in this tug of war with it, trying to solve it. It's there, but you can still live, and your hands are still free to do what they might do and go about your daily life, even if your problem is there. As this crisis unfolds, I'm sure many of you can acknowledge there's all sorts of obstacles in our lives. Things that we're not able to achieve, things we've taken for granted that we can no longer do, like riding the subway or going to a cafe for dinner. Problems for which there are no simple solutions. Take the time you need to process these obstacles and the emotions that this situation may bring. It's not easy. I mean, I can be the first to say that. But what I'm asking you right now is, can you still live your values? Can you still live in a way that's consistent with who you want to be and what you want to be about, even in the face of all these challenges? In acceptance and commitment therapy, we often think of values as a direction. So we often think about the idea that values are like heading north. You can never really reach north. A goal might be more like a specific destination, like Canada, for instance. You can reach a destination, you can reach a goal, but it's much harder to reach a direction on a compass. And that's how we think about values. Values can also be thought about as intentional qualities that join together a string of moments into a meaningful path. There's something that you do, or quality of something that you do, without an end point. Again, they never really stop. You never really reach, humility or honesty or power. It's possible that right now you won't be able to reach your original goals or simply solve problems for yourself. If your goal was to run a marathon right now, that might be tough with the ban on large events. But can you still make conscious choices or selections among alternative choices to move towards your values? Can you put feelings, pain, and goals aside to move towards these values? I know this isn't easy. Think about how you might be able to make choices right now towards still living the life that you have always wanted to live, particularly as a healthcare professional, while in the face of this crisis and all the obstacles that it's bringing. What brought you into this field? Take a moment and really think about that. I'm sure it's different for everyone. But what are the values that you want to stand for right now? I came up with some ideas of values that in healthcare you might have, as it's a caring profession that requires a degree of scientific knowledge, dedication, empathy. Here's some possible ideas for values you might have. There's no right answer. Promoting justice, making sure people have equal treatment or promoting equal care for everyone. Acting with courage in the face of this scary virus. Kindness, caring. And really, at the base of all of this, I think, is helping others. I'm just going to highlight the values of kindness and caring, as I think they're two values that a lot of individuals in healthcare professions might be able to relate to. When you think about living kindness and caring as two values, what are kind, caring ways that you can treat yourself as you go through your day to day? We're not only talking about other people. I think self-compassion is really important right now when we think about how hard it might be to get through a day or to reach your goals. What are kind words you can say to yourself and kind deeds you can do for yourself? They can be really small. What are kind and caring ways you can treat others who are suffering right now and contribute to your community? What can you say and do every day to enable you to look back in years to come and feel proud of your responses? I find that looking forward in a moment like this might be easier than looking back, looking at things we wish we had done differently, or even focusing on today. Let's look forward. What about tomorrow? Ironically, back to today, what can you do to make choices towards living your values and cultivating hope? This is your homework moving forward. Consider keeping track of small wins or moments of hope throughout your day that are leading you closer to your values in the present. Did you have a positive interaction with someone? Did you help someone today? Did you learn something today? Did you put your knowledge into practice today? Did you change the course of someone's day or hour or minute? What about your family and friends? What about for yourself? Are you still able to exercise right now, or read a book, or take a shower at the end of a hard day? Think about small wins. They really don't need to be big right now. Here are a few references on some resources that were used in the making of this presentation. additional resources that would be good to check out related to managing mental health during this crisis. We also wanted to provide the information for the National Suicide Prevention Lifeline, which is a 24-hour crisis hotline. And finally, if you're interested in talking more about your own values, check out the appendix for a series of pages on different values cards that you can look at, print out, cut out, whatever works for you. Thanks for listening.